My name is Danny Masters and I'm a physical therapist at CORE Therapy and Pilates, and today I'm going to be talking about cervical traction. So before we get started, I just want you to know that before starting any kind of exercise protocol or use of any equipment, make sure that you check with your doctor or physical therapist or healthcare provider that you are appropriate to do so. Cervical traction devices are designed to decompress and elongate the cervical spine or your neck by creating mechanical tension. Along with relieving pain and decreasing tension, it also helps with the flexibility of the tissues, and it decompresses the discs and the nerves in your neck. There are many different types of cervical traction devices, but most of them consist of a harness that's placed around your head and neck that are then attached to a system of pulleys, ropes, and weights that help create that pulling effect. There are also other types that utilize springs and air pressures to create that same kind of mechanical tension. One type of device that we use to simulate this kind of cervical traction is called a cranial cradle. So it's a little different in that it doesn't have any system of pulleys or weights. You simply lay on your back and it simulates the pull that we as physical therapists would do with our hands. These devices can be used to treat a variety of issues, including neck pain, herniated discs, degenerative disc disease, and cervical radiculopathy. Per recent studies, the best results come from people that have cervical radiculopathy and are experiencing pain down their arm or their hand that hasn't responded to other types of exercises or PT interventions. So the next question is are they safe to use at home? The answer is yes, but it should always be performed under the guidelines or the guidance of either a physical therapist, a doctor, or other kind of healthcare practitioner to make sure that, one, you are appropriate to do it, and two, you're trained and are using it appropriately. One of the benefits of the cranial cradle that we use and recommend is that since it doesn't utilize any pull or have any harness, people just have to be able to lay on their back and tolerate that. So that's a very safe way to create a similar type of pull as the other devices. So there are also people that are not appropriate for cervical traction. Those are people that have certain diseases and structural issues such as tumors, inflammation of the spine, or rheumatoid arthritis, malignancy of the spine, people that have vascular issues such as vertebro-basilar insufficiency, those that have had recent fractures or sprains that are less than 2 weeks old, those that have instrumentation or have had a fusion done in their spine, along with those who are pregnant, and also those who have osteoporosis. Another question is, why do you think these have become so popular recently? So, why I think that these devices have become popular is because people are experiencing a lot more neck and upper back pain due to the changes in our society. We have, transitioned to a more sedentary lifestyle where we're utilizing computers and cell phones a lot, which then contribute to postural issues. These postural issues have been affectionately termed as tech neck. So what happens a lot is we get this forward head, so our head is pointed forward like this, our shoulders are rounded, and then our upper back or thoracic spine increases in kyphosis, or what is known as it's a rounding of your back. So you get this kind of position, which then places a lot of stress on these structures back in here. And so you get a lot of increased tension in your muscles, and then you get a lot of pressure in the joints of your neck. Along with increasing the tension in your neck and putting pressure on your joints, you also get lengthening and weakening of the muscles in your neck, which help provide support to your spine, and you get tightening in the chest muscles here as well from the rounded shoulder position. So the final question is, what should our readers know about these devices and how they can benefit from them? So what I think people should know about cervical traction is that it's a tool to utilize to help improve some of their symptoms, but it's not a cure. So I think combining cervical traction with the use of exercises and ergonomics to improve those postural changes that I mentioned before is where you're going to make a big difference. It is important to remember that our bodies are meant to move. They're not meant to sit or stand or be in positions for extended periods of time. So remember, if you're having to work at a computer for long hours, remember to think about every 20 or 30 minutes just shifting your position. So like pulling your shoulders back, bringing your head back over your shoulders, making sure that you're not slouching or arching your low back. And to about every hour or two, at least getting up, walking around for at least 5 or 10 minutes. Another important or crucial aspect of this is to have good ergonomics of your equipment. So what this means is, like for your computer at your desk, making sure that it's at your monitor is at eye level so that you're not leaning your head forward. Making sure that you adjust the height on your chair so that your knees are slightly below your hips, that you have good lumbar support, and that you bring your armrests up so that your arms are about 90 degrees. Another important aspect as well is if you know that you have to use your cell phone for long periods, is trying to bring it up to head level instead of holding it just like this and looking at it for extended periods. So along with utilizing the cervical traction and improving the ergonomics of your workstation or of your sitting situation, working on exercises to retrain the muscles and improve the length is also important. So first, what's important is doing some mobility exercises for the neck and the upper back to assist in improving the movement of the joints, along with doing some stretches for your neck and upper back muscles that are tight and short. So some good exercises that you can start with are some chin tucks, which depending on how you do them can be good for mobility, stretching, or strengthening of the muscles here. And then also doing some mobility exercises such as cat and cow or thread the needle, which is good for working on your upper back. Good stretching exercises can include stretching out your chest here, so working on your pecs or your pectoralis major and minor, also working on your diaphragm as well. Other stretches can include for your upper shoulders and neck, such as the muscles right underneath your skull, and other muscles such as in your shoulders and your neck, like the upper traps, your levator scapulae, and your scalenes, which are here on your neck. After performing the mobility and the stretching exercises, you can then follow them up with strengthening to help maintain those changes. So working on your scapular muscles, such as your middle trap and lower trap, or middle and lower trapezius muscles, your rhomboids and your serratus anterior, to make sure that you can maintain those changes after opening up your chest and stretching out and working on the lengthening of the tight muscles and improving the mobility of the joints. Okay, so that's the end for the video on cervical traction. So I hope you guys enjoy it and found it informative. And please, if you can, subscribe to our channel by clicking the button below. And if you're in the Austin area and interested in receiving some treatment or getting to know us here at CORE Therapy and Pilates, feel free to give us a call at 512-215-4227. Okay, have a great day.